Good morning. My name is Angela Botley. I'm the clinical trainer for VIVOSONIC, and we do provide extensive training to new users on this system, so they're left with full comfort level. I'm just going to do a very quick demonstration to show that it actually does work and apply all the sufficiency criteria, etc., the tools that Dr. Marcoux was just discussing, and how you can use it to decrease your test time and increase your test confidence. I'm already set up, obviously, but just so you know, to apply these electrodes, you don't have to dig a hole in the scalp to get good impedance. So a few swipes of a prep pad is going to work for probably 99% of your patients. Anyone who's done ABRs is familiar with these ER3A transducers. I'm going to do my left ear. I'm going to start off with a high intensity click, and I'm going to walk around a bit so you can see that you can collect ABRs under non-ideal conditions. Okay. So this noise down here will reflect all of the muscle activity, the acoustic activity, which normally right now every single sweep would be getting rejected, because this is of course way, way above that 1/2 microvolt response that a good ABR will get you. But you'll notice that where the average is collecting, it's not interfering with that at all. Okay, continuing to collect nice and smoothly. Now, to help us out a little, we're going to apply some normal latency values. Okay. For an adult at 80 dB, this is the range of normal latency for waves 1, 3, and 5. Okay. Now, in addition, you know that no matter how good your waveforms look, how normal they look, if they don't repeat, they might as well not be there. So instead of stopping it and repeating it, I want to make sure it's repeating prior to stopping. So I'm going to use this A comma B function. All of the sweeps are in the main trace, half of those sweeps are in A, the other half are in B. So A and B are exclusive traces, they don't share any sweeps. So if they are similar or repeating, that means you have a present and repeating waveform. Okay? The statistical tools that is describing on top of that will give you a completely objective measure of how well they're repeating. Because you know that if you are under a lot of pressure to see a response, you might see a response. Okay, so we're going to take statistical start, place it at the beginning, statistical end, at the end of the point of interest, and you can see the correlation coefficient is 0.75, well above the 0.6 that they were using as their target in their particular research project. Okay. Okay, so now I can stop and be confident that I have a normal response and it is repeating. And I did not do anything to help it. I was not relaxed at all, walking around, yelling into a microphone, all the things you're not supposed to do. Okay, so now I'm going to do one at a very low intensity. I'm going to take this down to 30. And repeat, exact same procedure. Okay, so in a few seconds there, I have a repeating waveform at 30 dB. Now, if you're not happy with how well that looks, you just run it for a few more sweeps. But statistically, you can see that the correlation is 0.91 at 1100 sweeps, which is only 500 each in A and B.